Happy Halloween. Of course you can. If anybody's hungry, I got some whole lunch over there. I got a little chocolate.
Oh,
I know, right?
no, thanks for the reminder.
Oh, you have some for us?
I do. Because I'm
All right, and then we're gonna go right to the skull. So take out a piece of paper. Number one, I want you to tell me, when we look at the skull, this is the front, this is the back. On the back, what's that big bump called in the back? The big bump on the back of the head, what's that called? That's number one. Don't say it, just write it down. That's number one. Then number two, we're gonna go turn the skull sideways, and this hole is the ear hole. And behind the ear hole, we have a bump. If you press it hard, it hurts a little bit because it's sort of porous bone. What is that bump behind the ear called? Number two. And then we open the skull up and take the top off, whoop, like without saw, it just comes up, magical. And we look inside. This is the front, this is the back. We have a big hole in the middle. Right in front, anterior to that big hole, we got an indentation. What is that called? That is where the pituitary gland sits in. And you want a gland in something enclosed in bone, sitting inside a brain that is soft and malleable, because glandular tissue grows really rapidly if it wants to and is given this opportunity. It's epithelial, it's like skin kind of tissue. So that's why it is enclosed in this thing in here. And then right in front of that, anterior to that, we got this area that has a bunch of little holes in them that are actually the nerves that come through the nose that we smell with. It's just the holes are not open in the plastic skull. They're that small. What is that area called? That's number four. What's that area called? And then let's look at the let's look at the bone that makes up the upper jaw. What is that bone called? Number five. The bone that makes up the upper jaw. What's that bone called? And then number six, we're gonna go to the facial muscles a little bit. And we're gonna look at a muscle that is attached. When you look at, you're looking at the corner of the mouth, you have a bunch of muscles at the corner, around the mouth. You have one that circles the mouth, and then you have one that's attached on the lip, sort of on the top part, and one on the bottom part. And then you got one attached on the corner of the mouth on the top, and then one on the bottom part. I want you to tell me the one that's attached in the corner of the mouth and pulls the corner of the mouth downward. So it's in the bottom part. What is that called? Number seven. Let's go and just go to that one that is right here on the side that goes up and down and is right here, and it helps us chewing. Closes the mouth. You have this big fat muscle. You can feel it when you clench your teeth. It's pretty fat. It's pretty thick. So when you see this big vertebra, you have a few bumps attached to it, a few structures that we learned on the labeling thing. I want you to tell me, what is the bump that sticks back outward on this vertebra called? The bump that goes backwards. This one. This one. What is that called? That was what, number 7?
Yeah.
Good. 8. Thank you. Yeah, somebody should just say it. And then number 9, this is the vertebra number 2. The second one from the top. The first one is just round. it has a few pieces missing, sort of, when you look at the generic structure. But you know, it's got to balance the skull, like there's a wobble head up there. And then the second one is this one that has this thing sticking up that goes on through it onto the first one and makes the head go turn left and right. So this is the reason why we can say, no, not today. So what is that bump called in the technical terms? All right, so that's the spine, and then we're going to go into the pelvis. And when we look at the pelvis, we went to what, number 8 now? Oh, shoot, we got to do 5 more and then we'll stop. When we look at the pelvis, we have the spine coming down. This is the sacrum. That's that triangular bone. That's also on the list. It's just not a question right now. And then on each side, we have these pelvic hemispheres, and they're sitting in the body like that. And we're having a thing where this part here, I can't say the word. This part here where the baby can sit on, and if we follow this part back, all the way to the back, we have a big bump in the back of our butt, kind of in here. Dimple sometimes is where that happens. And what is that part called? It's a long multi-word name. You could just, if you know what you're talking about, you can use the abbreviation. That's fine. If you write a report, you want to piss people off, want to make words, you write it out. Well, you know. I mean, I had a guy, literally, my one deposition that I did, that was it. A guy got hit by a drunk driver. I saw him for like 15 grand, and then they wanted to talk to me about, I don't know what. But they were from some other place, middle of America somewhere. And they called, and it says, oh, Dr. Milligan, blah, 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 hello, how are you? Well, let me tell you, we think, you're from California, right? We think you guys in California are a little bit cuckoo. I'm like, really? Well, as a matter of fact, I'm from Switzerland. So in Switzerland, we think you in America are all cuckoo. And that, of course, I didn't make the case. But I had to say it. I just couldn't let it be. Like, really? You're going to tell me that on a professional meeting like that? Like, oh. And he was like 20 years old. It sounded like my heart was going like I was like 30. I'm like, no, that's how you learn these kind of things. Sometimes you just got to put the foot down. No, it's important. Anyway. So, you got that? Good. And then, the other part I want you to tell me is, what is that in the front here? We have a joint. Is that on the list? Yeah, we have a joint where the bones come together. And this is actually a really problematic part when you're pregnant, when people are pregnant, because you got this thing in your system called relaxin that makes every joint bendy, makes you all bendy. So that's why it's hard to walk, because it's all bendy, it's not stable anymore. And we all go like, look, no, it's really, really difficult. And often there's a pain associated with that, and that's pubic, oh shoot, I shouldn't say it, but that's an itis. And so it's that word I want you to tell me, and then at the end you put an itis. And so that's where you learn the word itis, because whenever you see the word itis, you know it's an inflammation. I-T-I-S, like arthritis. Just means it's an inflammation in the joint. You have 50 different arthritis. We just think of one of them most of the time as old age arthritis, but you can have a whole bunch of RAs and gout and all kind of stuff. It just means an inflammation of the joint, really, if you look at the language. So that's another thing that I always encourage students to do, is look at the words really carefully and look at the language, because it tells you a lot of stuff, these words, and how it's described. So looking at the leg bone, we got the femur. And we got this looking like thing, like it's sitting there like that. And what's that big bump on the outside of the femur called? That's number 12?
Yes.
Ha! There you go, number 12. The big bump on the outside of the femur. We got a smaller one on the inside, but we're not going to do that. And then we go all the way down to the knee, and in the front of the knee, we got a big bump, number 13. What's that bump in the front of the knee called? That's right here. That's actually where you kneel down if you kneel down. That's where you kneel on. I had a patient come in and she had a boot on, and a podiatrist saw something broken here. It turned out to be calcifications, and he wanted to do surgery. And I'm like, I'm not going to touch the foot because that's not my territory. If he's sending me in, he's the podiatrist. Can we talk about the knee? Anything happened to the knee? And she's like, yeah, 3 years ago she fell on that knee really hard. onto a door ledge kind of thing, like a sharp ledge. And it was still tender and hurting. I touched her here, she was almost to the roof. We worked on her knees, she couldn't leave the boot behind. Because it wasn't the boot, that was the problem. It was all the muscles that were all so tight and pulling on it because, and it was like the history didn't say it was a broken bone. She didn't kick anybody or fall down or so. So that's where you also, as a everybody person or starting in the process, you want to start that clinical thinking. If something don't make sense, you go look it up, make sense of it as much as you can. Otherwise, text me. I'll try to figure it out with you. I'm here. Once you're a student, you can always text me. My number won't change. Anyway, that was number 13, right? Number 14, I want you to tell me the proper name for the heel bone. What's the heel bone called? The heel bone. Good. Number 15 is going to be on the arm. Now we get to the last bone today, the arm. Blue bone. And we have a shoulder blade. And we have a shoulder blade that's in the back and one part from the front. I want you to tell me what's this area in the front called that lays onto the ribs. What is that area called, that flat area? I always do stuff in the back. Let's do stuff in the front. I know. If you have shoulder problem, you massage this area. It really helps. It's really hard to get to. That's why nobody does it. Anyway, then number 16, I want you to tell me. Oh yeah, we did the knee where you kneel on the knee. Let's do where you hold the elbow. What's the elbow proper part called? This is on the ulna. This part is on the ulna, but this round structure that sort of holds on to the humerus. What's that structure called? Then one more. When we go distally towards the hand, that's what distally means. Proximally means, we use those really in the attachments. Proximal means more the shoulder and the hip, and distal means more towards the hand. But we describe it relating to each other, so you can still say this point is distal to this point, even if you're in the shoulder. It's relationship based. So, that's just slowly you're learning some of those terms as we go through it over time. And then it becomes second nature. It's not really that big of a deal. It's just a big deal in the first chapter. That's why it's like. Anyway, the last one I want you to tell me is let's go on the thumb side. We have this thing sticking out at the bottom here. What's that thing called? Right here at the end. All right. So, are you completely lost, or are you feeling like there's something pretty good, or what do you feel about it? All right. So, what was number? Now you have to just do it. I don't remember. Number bump in the back of the head. Everybody need to scream it. EOP. Come on, I have the costume on. At least you gotta help me out. EOP. There you go. And then number 2. Oh, the bump behind the ear. Yes. What's the bump behind the ear called? I thought you said you had it. Come on. Mastoid process. Good job. And then we went into the skull, right? And we did the place where the pituitary gland sits in. What's that called? Cella turcica, or Turkish salad, but right cella turcica on the test. And then we went to the place where we can smell through, where the holes are for the smelling. What's that called? The cribriform plate. And also in there we got the crista galli, right in there too. We have these 2 structures right there. But if I tag it on the test, it's fine. I'll take either. Don't go, because it's hard. Taking a test can be anxiety provoking. Test anxiety is a real thing. And so I want you to be trying as much as you can when things are like ambiguous, like, oh, I have 2 turn scoop either or. I'm gonna take both. All right, just try to take a deep breath and be like, okay, if he's doing it wrong, at least I can talk to him because it's on tape that he says I'm going to take them both. All right? So please. But it's easier to learn when you're relaxed. So it's just, the problem is the teachers always think when people are relaxed and they're lazy. And that's not the case. As long as we're making it interesting, you still got to do the work. All right, what was next? Oh yeah, the upper jaw. What was the upper jawbone called? Maxilla. Perfect. All right. And I think then we left the skull, right? And we went to the muscles. And we did two in here. And we did the one a corner of the mouth going down. What was that called? Depressor anguli oris. Angle as in the corner of the mouth. That's what the angle means, like in a geometric angle thing. And then the last here we did the thing that goes up and down, the chewing muscle. And that's the masseter. Perfect. Good. What's this called? Spinous process, correct? And then we went to the second vertebra and we looked at what was that called? The dens, or also known as the odontoid process. Depends on which book you're looking at. Of course, in the test, don't worry, I'll take them both. You just look on the list. In the test, it's open book. You have a list. That's why, you know, the way to really study this stuff is you making a cheat sheet. And you drawing it yourself and making it so that you have easy access and can reference it back. That's really your work in here. It's not memorizing it. Of course, when we do these drills, it helps us remember it. So that makes it easier too. All right, but then we get to this, right? What was that? That PSI is the posterior superior iliac spine. We have one below, right here, that bump. That's the PIIS, posterior inferior iliac spine. But we don't gotta worry about that. But if whenever you see superior, you think, where's the inferior? You know, otherwise, why name it? And if they still have a name, you're like, really? Why would they name it? Then the anatomist will say, whoa. Then we did this, right? What was that? The pubic symphysis, the pubic bone. We had a patient, she was 25 and I just got out and I was an assistant person. She got hit by a truck at 17 or 16 and she had to go to the bathroom every 15 minutes. Couldn't hold the job. And my old chiropractor then, he would like go and palpate people here. Like, is this forward or back? This was almost dislocated. The bladder is right here. It irritated. After a few visits, she got older, pee more and longer and longer and longer. It was fine. It was a physical somebody, pushing on your bladder. Of course you're gonna go pee. It's like, no, it's like, but an x-ray wouldn't show that because it's angled in a weird way that you don't see that displacement and, you can't really palpate people there because everyone was like, ah. You can't do that. And so very often things don't get done. Now, where are we going from there? We're going to the lower extremity, right? And the leg. And we got what? The big bump on the side of the leg. Greater trochanter. And then we got the bump in the front of the knee. Tibial tuberosity. Very good. And then we finally finished up with the shoulder blade. The underneath part of the shoulder blade, what's that called? Subscapular fossa, very good. And then from there we went to the elbow proper, what's that called? Huh? Olecranon process, very, very good. And lastly, we finished up with the stylus process. The styloid process, sorry. I think, right? Does it say styloid?
Yeah.
Yeah, and there's one on the radius. And there's one on the ulna too, because they basically form a round thing that then the carpals can sit in right here, and then you can do a little bit of this motion, like this motion, and this kind of, the multiple bones making that joint. You kind of visualize that, right? So that's how that structure is by the camera. All right, bene.